G'day mates, Mel is a true SleepHQ superhero. Despite facing challenges with sleep apnea, type 2 diabetes and emphysema, the trifecta, and previously weighing 320 pounds, the quaddie, she has turned her life around dramatically. She's an inspiration. Over the past 18 months, she's lost 73 pounds, controlled her blood sugar levels, and significantly reduced the pressure required to manage her sleep apnea. Her secret, you might ask? A groundbreaking new medication called Tirzepatide. Mel's journey is a powerful testament to the possibilities of these new weight loss wonder drugs. I'm very proud of her and I'm excited for the future. Now, this week marked a groundbreaking moment for the sleep apnea industry as Eli Lilly, manufacturer of Tirzepatide, unveiled the results of an extensive 52-week study looking at sleep apnea and weight loss. And the study revealed that Tirzepatide significantly reduces the severity of obstructive sleep apnea by nearly 2/3 in adults who are also dealing with obesity. And those participants also experienced a very impressive average weight loss of around 20%. Wow. The weight loss revolution, guys, it is here, it is happening right now. Whether you like it or not, side effects, what will happen in the future, who the bloody hell knows? What is happening right now is these drugs are going to take over the weight loss industry, and those of you with sleep apnea, your treatment will change, your settings will change, your mask size will change, everything will change, and I'm about to show you this right now with Mel's SleepHQ data. Let's check it out. Now, if you're tuning in for the first time, g'day, warm welcome to the channel. SleepHQ is my cloud-based CPAP therapy management platform, and we designed it to help anyone with sleep apnea. So you can check out your CPAP therapy charts. You can connect up to Apple Health to see your sleep. You can connect up pulse oximeters to view your blood oxygen level. It's a wonderful platform. You can check it out for free, sleephq.com. Let's have a look at Mel's incredible transformation. And this is stuff you can do as well. So to start, let's take a look at Mel's therapy trends over the past few years. And then we'll switch over to the day view for more in-depth analysis. So Feb 9th, 2022 to April 20th, 2024. Right here, right now, she's lost 73 pounds and the pressure required to treat her sleep apnea has changed dramatically. We'll scroll down to the pressure trend chart down the bottom here. Okay, here it is. Now back here, 2022, the median pressure delivery, 18.62, 18.36, 18.44, around 18.5. Come forward to 2023, 15, 15.2. Around the 15 mark. Fast forward to now, 10.34, 10.6. So the pressure required to treat her sleep apnea has reduced significantly. And if we come up here to the AHI trend here, we did have this big spike here. You can see it trending up. I'll talk about that in a moment. But right now, look at this. 0. Perfect score. Well done, Mel. 0 again. 0.14, 0 again, like flawless results, incredible, and the pressure required has halved. So let's talk about this little section here, and this is why the trend view is so powerful. It's fun to look at your results day to day, but when you zoom out, get a much clearer picture. Okay, now let's scroll down and look for clues in some of these other trend charts as to why there was an uptrend in the AHI here. The first thing we'll take a look at is the pressure. Any changes in the settings? Doesn't look like it. Scroll down a little further. This here is the leak rate trend chart. So this can be mask leak, air coming out the side of your mask, or mouth leak if you're wearing a nasal or nasal pillow mask, air rushing out of your mouth. It can also be from full face mask as well if your jaw drops below the seal. Okay, but what we can see is this. You can see there's two clear trends here. You've got one here back in 2022 to the start of 2023. See how it's gradually increasing? And then we have this great period here where there's just no leak. Beautiful. Actually, come up a bit. Let's have a look here. Look at that. You can actually see the AHI dropping during this period as well. See that low point? Okay, so that's this period here. And then we've got another trend starting to emerge here with some big bars here. And if we scroll up again, you can see, look at that. All right. See how it all lines up? So to start, let's talk about what could be causing this mask leak. Number one, it could just be wear and tear on the mask itself. If you're not updating your mask cushion and your headgear on a regular basis, they wear over time. They stretch, the silicone gets soft, and it's more chance that the air is going to escape. So that could be number one. Number two, it could be because she's losing weight. So her face is shrinking. Maybe she needs a smaller headgear. Maybe she needs a different size cushion. I don't know. But from what she's told me, that's exactly what happened here. She needed to get resized for a CPAP mask, and then straight away, leak rates dropped. Don't worry about this one here. This is because she's just taken her mask off to go to the toilet or something like that. And now look at this here. 0.000000000. And that lines up beautifully with the 0.00 AHI. Perfect results. All right, so I wanted to show you that. And the last thing that caught my eye, which is fascinating, is this section here. All right, her respiratory therapist, who is changing her pressure remotely, drops the pressure down here, but they also changed another setting, and this resulted in a huge reduction in the airflow limitation trace. You can see it right here. This falls off a cliff, and this is great news for Mel. Airflow limitation is upper airway resistance. There's a restriction right here, and it's reducing airflow during inhalation. So it's great to see a big drop here, and I can't wait to show you what caused the drop, because it's a great lesson for not only you guys as patients, but also for clinicians. All right, but you can clearly see here a lot of airflow limitation throughout the night. The closer this value gets to 1, the more severe the airflow limitation. But don't underestimate it. For those of you watching right now, if your AHI is really good and you still feel like shit, have a good hard look at your airflow limitation trace. Because a lot of the time what happens is people open up the MyAir, they get a great score, they see their AHI thumbs up, but there's still a lot of upper airway resistance. And I'm going to show you right now just how much of a difference that makes to the air flowing into your lungs. Blah, 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 blah. All right, we've seen enough trends. Let's switch over to the daily view for some more fun. Back in August 2022, and the results are great. Mel's results have always been exceptional, but I want to show you this. Apnea hypopnea index 0.55, great. We'll scroll down, check out the pressure chart. So this is the automatic pressure delivery from her AirSense 10 changing throughout the night. And you can see right here, it's very, very high. Up here at 20, as high as it goes. 20 again, 20 again. It likely wants to go higher than 20, but 20 is the maximum on a CPAP machine. With a bi-level device, you can go a bit higher. Okay, so looking pretty good. Any doctor, clinician who sees these results would be very pleased. However, I want to show you this. So like I said before, let's check out the airflow limitation trace. And I have a few other traces I want to show you here as well. So we can see that as the airflow limitation trace starts to increase, the pressure also increases here. You can see it go from 18.5 up to 20. So it jumps up because the ResMed automatic pressure algorithm is very, very sensitive to this trace. ResMed knows how important it is because the pressure changes in response to it. However, they don't really report any of this stuff to the patients. You really only see it on SleepHQ. Okay, now if we scroll down further, I want to show you what impact it has on the air flowing into your lungs with each breath. All right, I'm going to zoom in. Crazy. Okay, so we have this chart here, tidal volume. Respiratory terminology is always a little confusing. Just think of it as airflow into your lungs with every breath, and it's milliliters of oxygen per breath. All right, think of it like that, much easier. Now, up here where there is no flow limitation, look at it here, 500, 520, beautiful, 480. But as we scroll forward, you can see the airflow limitations start to increase, and just have a look at the dramatic impact it has on the air flowing into your lungs with each breath. Here it is up here, 480, 500 before. As the airflow limitation increases, It's only at 0.42 here. Look at it. It's like halved. 220. Look at down here. 160. Right, and that just shows you the value of that trace right there. Okay, all of a sudden, no airflow limitation. Look, boom, back up to 620. So that AHI number is so deceiving because you think because it's low, you're doing well. Check out your airflow limitation trace on SleepHQ. I'll reset the charts. So this is back in 2022, and you can see the pattern here as well. Here. Anytime there's a big spike in airflow limitation, look at the air flowing into your lungs. Here as well. Look at it drop right down here. 100. All right, let's go forward now to 2024, and I want to show you that period that I showed you before when we saw that dramatic improvement in the airflow limitation trace. All right, let's take a look. All right, so fast forward, Saturday, March 9th, 2024, and her pressure settings are lower now. Pressure max 15, pressure min 12, and once again, if we scroll down here, we can see the pressure trace moving through the night. Previously in 2022, it was butting its head up against 20. She's lost a lot of weight. It's much lower now, okay? It's still butting its head up against 15 here. She likely needs a little bit more pressure, but it's pretty good. She's also added the SpO2 trace. This is blood oxygen. We didn't have that before back in 2022, so we've got this now. And she's using a SleepHQ O2 ring here. She just puts it on during the night, syncs up with all those CPAP data, and we can see her blood oxygen here. And I want to talk about that in a minute as well. But as we can still see, if we scroll down, we still have a lot of airflow limitation here. And you can see once again the big drops in tidal volume, the amount of air moving into our lungs. Now, normally, for most of you watching right now, that will also result in a drop in your blood oxygen levels. You'll see it. They will fall down. But with Mel, we don't see it, and the reason is she's also on supplemental oxygen. She's got an oxygen concentrator as well. I want to quickly show you what airflow limitation breathing looks like under the microscope and compare it with normal breathing. Let's check out the profile. We'll start with normal breathing. I'm just going to click and zoom on the breathing trace. This is Mel's breathing. Every breath she takes, we can see it right here, high resolution on SleepHQ. Unbelievable. And what you can see is with every breath in, you can see how the breaths have sort of like a point to them, like a sharp point. I'll zoom in a bit more for you. Okay, so you can see it comes up, breathing in, point, breathing down, point, or maybe slightly rounded at the top. But that's what sort of normal breathing looks like. Nice and steady, nice and regular, nice and even, with like a rounded point or a point at the top. Now let's check out some airflow limitation breathing. I'll just reset the charts by pressing R. And let's zoom in here to this section now. Have a look at the change. All right, this is a great example. So before we had those nice rounded peaks, and now look, they're cut off. Can you see they're all lumpy at the top of the inhalation? See how they're all flatlined? That's the airflow limitation. That's that upper airway resistance. There's no apnea flags there. There's no hypopnea flags there. But it does cause a big reduction in air getting down into your lungs. It causes a lot of sleep disturbance. All right, so we've saved the best till last. And this is such an important lesson, so pay close attention. We've got two results side by side, a slight change in the settings, but a very powerful change. Over here, Saturday, March the 9th, these are the results we were just looking at a moment ago. And then a couple of weeks later, let's scroll down and take a look at the machine settings. So we've got a pressure min of 12, a pressure max of 15. That's the pressure range, 3 centimeters. The machine won't go above 15. It won't go below 12, and it will adjust the pressure automatically between that range. We can see it down here. 15 comes down a bit, back up to 15. It is bumping its head up against the wall there at 15. Likely wants to go a bit higher. You can see it here. It's flatlining. okay? And then we have the EPR, right, which is pressure relief, off. So EPR is off. And we'll scroll down and check this out. We can see all the airflow limitation, which I showed you just before. So AHI is still good, but a lot of airflow limitation. And if Mel wasn't on oxygen, she'd be in big trouble right now, but she's on oxygen. And let's come over here. We have a pressure min of 10, a pressure max of 14. So we've dropped the pressure and we've also increased EPR to 3. This is pressure relief, and this also drops the pressure during exhalation. Really important. So all things considered, we are dropping the pressure in a big way, and you would expect with less pressure, there would be more airflow limitation. The results would be worse. That's what I'd be expecting. However, check this out. Let's take a quick look at the pressure trace. So over here, it's butting its head up against 15. Over here, it's nowhere near 14. It's barely hitting 12, right? We've got a pressure max, 14. It's barely hitting 12. So the pressure is not going anywhere near as high. A couple of weeks later, what the bloody hell is going on? Okay, let's scroll down a bit further. Check out the airflow limitation trace. Look at it here versus this here. Huge difference. If we scroll down to the tidal volume again, like I showed you previously. Wow. Huge drops. A few small drops, but so much better. These results are completely bonkers. They're nuts. We dropped the inhalation pressure. We dropped the exhalation pressure by increasing EPR. And you're telling me we got better results with less pressure, far less airflow limitation, better tidal volume? What's going on? Well, it all comes down to EPR, exhalation pressure relief. It's a complete enigma. That's what it is. There are so many studies that show reducing EPR improves your results. However, for some people, it does the opposite. And I think it comes down to the velocity of the airflow. Everyone's talking about pressure all the time. That's little air particles punching out the walls of your throat, pushing themselves down into your lungs. Right? That's pressure. No one's talking about the speed. No one's talking about the speed. One guy's talking about the speed. Velocity, my friends. And what I think is happening is this. Right, when you switch on EPR up to 3 for some people, not for everyone, and it seems to work better with the nasal pillows and the nasal masks versus the full face mask. But what can happen sometimes if you have a problem with this airflow limitation, increasing EPR increases the velocity as you inhale, because what happens is your turbine, your blower, it slows as you exhale to drop the pressure, so it slows. And then as you inhale, it's got to ramp up to bring that pressure up. So what it does is it goes almost instantaneously, and it hits the speed, and it pushes that air out at speed. And what I think happens is, because of that speed, and it actually increases the pressure slightly as well, because of that, it like pushes any of that resistance out of the way, and so you get the drop in the airflow limitation. I've used the analogy before and I'll use it again. Think of like water flowing down a river, and it's a gentle stream, and you've got all these branches in the river, which are the airflow limitation, trees that have fallen down, rocks and so on. And then all of a sudden you get like a flood, big downpour of rain, and the velocity of the river increases dramatically. What happens to all that stuff? All the resistance gone. You just get a flow of water straight down the river. I think that's what's happening with air. It's just my hypothesis, but I don't know how else to explain it. How else do you explain dropping the pressure and getting better results? It's nothing to do with leak. Who the bloody hell knows? But what a fantastic result. Congratulations. Hey guys, thanks for watching. Until next time, sleep well, look after your mates, and make every moment count. Cheers.